Hi, we are live with a special guest from Seoul, Korea. I am here with Dr. Alice Tan. Doctor, can you say hi to the folks here in NY27?
Hello, NY27.
So, Dr. Tan, she is a U.S. citizen. But you're dual citizenship, right? Korea and America. Oh, no, go
I
ahead.
am an American citizen.
Okay,
I have residency status here in Korea. My daughters are dual citizens.
gotcha. But you grew up mostly in Northern California, I think?
Exactly. So I'm a California girl. I grew up in the San Francisco Bay Area. I moved to California when I was 4, and we lived in the neighborhood Cupertino. So that city might sound familiar because that's where Apple Computers is headquartered. And so I used to drive by Apple Computers headquarters when they were, just transitioning out of their garage into like an actual building.
Wow.
That's where I grew up. Yeah,
So you grew up right there in Silicon Valley.
exactly.
Wow. So then you spent some time overseas in Korea. You actually, I think you got your medical degree in Korea, and then you did your
Yes.
residency in the States, right?
In Illinois, yes.
In Illinois. And listen, I know you because when I was in Korea, I had some expat friends,
Mm-hmm.
and I don't want to put words in your mouth, but you were kind of like the doctor of of many very prominent Americans living in Seoul. Is that? Go ahead.
Right, because I'm board certified both in America and in South Korea, and obviously I'm fluent in English. So I had a lot of expat foreign patients here in Seoul, and so our connection, our mutual friend, is the amazing Miss Amy Jackson, who was the president of the American Chamber of Commerce here in Korea. And
Yep.
so I first met you at Amy's Thanksgiving Day party, arguably the best Thanksgiving party in Asia. And
Maybe anywhere, honestly.
Right. And I remember thinking, wow, you're a really tall American for living in Korea. But then I remember you're a really smart guy, really able, and then just sincere and so friendly. And so I've been a friend and a fan of Nate ever since.
Listen, I'm proud to know you. You're one of these people who's so darn smart and so darn kind and so darn educated that you make anyone who comes in contact with you their life better. And I'm grateful to know you. And I am embarrassed at that party because I am a little bit taller than average. I always struggle to find clothes in Korea. And I think if Amy's watching, the famous moment from that party was the horror and humiliation when I walked in with extra, extra, extra tight jeans on. Because I went to Uniqlo to get some nice clothes. So I wanted to look good for the Thanksgiving party. And they only had sizes that were like 2 or 3 sizes too small for me. And I gave it a shot. It didn't work. So Amy, listen, or Alice, let me talk to you real quick about what you're doing now. I wanted to have you on the show because you and I had a casual conversation about just about what's going on in Korea because I wanted to know. So I called you. You're kind enough to talk to me, and I appreciate that. To spend your time with me. And I thought, wow, I want people in NY27 to hear this. So I know you've done presentations for various different parties about this very subject. You have some online presentations, but I thought we have this forum. Let me share the experience from someone who's an American citizen overseas and what happened in Korea. So let's talk about first the history of Korea dealing with some pandemics in the past. Can we?
Yeah. Right. So, and that's very important because I think that was critical to how our response was so quick. And timing is of the essence when we're dealing with COVID-19. It spreads so quickly. And so you need to mobilize very quickly to get control of it early on. Otherwise, it will explode like we're seeing in New York City, like we're seeing in the UK. It can just explode and overwhelm the system. So back in 2015, we had a very big outbreak of a disease called MERS, which stands for Middle East Respiratory Syndrome. And it's the same kind of coronavirus that causes MERS that causes COVID-19. And at that time, the response was very opaque. It wasn't transparent at all. It was very secretive what was going on. And as a result of our experience with MERS, we realized that we need to be sort of the opposite. We need to be very transparent with the public in terms of dealing with an infectious disease. And we needed to act at a scale that was very big, and in terms of contact tracing and tracking. The scale
So let me pause you because I think that's
yeah,
an interesting point. So you were working at the time, I think, at Samsung Hospital, right? Which is one of
Samsung
the
Medical Center.
Samsung Medical Center is arguably the best hospital in South Korea.
Right.
And I have to say this because people don't know. South Korea is extremely, we'll get into that, I think, but extremely technologically advanced in many ways, including a hyper sophisticated biotech industry, extremely good internet backbone and broadband backbone. So it all comes into this story. But you were at this hospital, which was a very respected hospital, and when MERS hit, Middle Eastern Respiratory Syndrome, it was completely shut down. No one knew what was going on, and that caused a lot of pain for people that were infected. Correct? Is that fair to say?
Exactly, right. So I was working at that hospital. We had one gentleman who ended up infecting 82 other people. And I didn't even know what was going on, even though I was working at the hospital where it was ground zero. And so it was very opaque. But as a result of the MERS outbreak, our entire hospital, it's a 2,000 bed hospital. We see thousands of patients every day. Our hospital had to shut down for 1 month. And the entire economy of Korea also shut down for maybe, I'd say, 2-3 months as a result of this MERS outbreak. So there was not just the healthcare impact, but the economic and the social impact of MERS that kind of traumatized our country. And the memory is still fresh. I still remember exactly how I felt and what happened in 2015 during MERS. And I think collectively as a country, we were, affected by it. And also, we have a memory of what happened. So when, COVID-19 broke out in China, this is right next door, right, to Korea. We had one, hand on our pulse of sort of what was going on infectious disease wise, and then the other hand on the trigger in terms of what we needed to do. And so we knew that something like MERS could happen again.
So because you had been through one pandemic, you're like, the entire nation said, we're going to prepare. So when this happens again, we're ready. And
Exactly.
it seems to me the big change was we're going to be hyper transparent, and we're going to make sure everyone knows what's. Go ahead. I'm sorry.
Yeah, that's one aspect of it, but it's so crucial because public needs to know what's going on. The public participation is essential to controlling a respiratory infectious disease. And if the people are not on board in terms of they need to know what's going on, they need to understand the disease, and then they need to know what they need to do. And if you don't have that public transportation, basically the fight it's over. You're defeated even before you start.
So the key here was that in South Korea they were transparent, but more than that, there was public buy-in because they had been through it before. You must be troubled by what you're seeing in America then, because first of all, we don't have clear leadership, and so you have confusion. Like I talk to people every day who's like, it's not real or it's overblown. So how did Korea address that issue? Because it seems like everyone in Korea is like, okay, we got to take care of this. We know. Is that also because of the experience previously in 2015, you think, or what is that?
Okay, so back in 2015, one of the mistakes was the Korean CDC, so the Centers for Disease Control and Prevention. They were in the background and the politicians were on the foreground. And we realized afterwards that it needs to be the other way around. The public health authorities need to be front and center, and they need to be giving information directly to the people. And so in the beginning of COVID-19, the Korean CDC, they were actually giving 2 press conferences per day. And of course, the press, they're acting sort of as the voice of as the curiosity of the people, right? And so the Korean CDC, they were giving press conferences, telling people exactly what is going on.
The health officials directly communicating to the public.
Exactly.
So it wasn't politicized at all.
Not this time, no, because we learned from MERS what happens when the public health officials are in the background. That's not where they need to be. They need to be front and center, informing the public, but also informing the rest of the government in terms of what supportive role the government needs to play. So in terms of the central role, it needs to be the public health officials. And that's what happened this time for COVID-19. And I think that was just so important in giving timely and trustworthy information. And when you have the trust of the people, then they can mobilize and do the right thing.
So clear communication with reliable information from experts, the experience that allowed you to do that, and then transparency.
Exactly.
So here, but then, we're still not testing properly. Like I was on the radio, a local radio station the other day, and the guy I'm running against said, "Oh, our tests are great. We have a great testing program." I'm like, "No, we don't." Mm-hmm. Tell me, first of all, how did Korea get their tests together so fast? And number 2, tell people here, what does testing look like in Korea? And before you do that, I want to describe Seoul for a second. I don't know where you live in Seoul, but it is incredibly dense. It may be the most densely populated place in the entire world. Yeah. There's just the skyscrapers everywhere, layers and layers of mass transit under the ground. People are everywhere. So, right. So the fact that it didn't spread like crazy there, it's kind of amazing to me. But also, how did you test all those people? Okay, so can we talk about testing for a second?
Yeah, so testing. So we have a very robust biotech industry in Korea. So when we saw what was going on in China, initially we used the test kits that were distributed by the WHO. But then we started to have our own few cases, domestic cases. And so once we have a patient, then we can extract the virus from that patient, and then we have the genetic code. Once you have that code, then you can make a test for that virus. And so the Korean CDC, the government, we got together our biotech company leaders, and we said, hey, this is what's going on. We need to develop a domestic test kit. And we gave emergency use approval to 5 companies from the get-go. And we said, we have a big problem. We need massive testing. Go, make the test kits. And we gave them the approval. And they started making thousands and thousands of test kits.
Almost the exact opposite that would happen in the States, where the administration here said, we don't want the WHO's tests. We're going to make our own. They didn't really do it on a massive scale. They made tests that didn't work. They didn't force or even nudge the private industry to do it for months and months and months. So it's almost the exact opposite story. Right? Sorry.
Yeah, perhaps. But yeah, it was, as I said, our response was timely. It was quick. We recognized the need for massive testing. And so it was ramped up very quickly. And in terms of, what does testing look like? I'll give you an example. So very recently, we had an outbreak in a region called Itaewon, which is kind of a nightlife, center here in Seoul. Right. And, I'll just run you through what happened. So there was a 29-year-old guy. He felt kind of crummy. And so on May 5th, he decided that he was going to get tested for COVID-19. He got tested May 5th. May 6th, the test came back positive. So immediately he was hospitalized and put in an isolation ward. But then what happens is a group of epidemiologists, they're kind of the detectives that, you know, work in infectious disease. They started interviewing him. They said, okay, when did you first start having symptoms? He said, May 2nd. They said, okay, so starting from May 2nd, let's go back 2 weeks. Tell me everyone that you met and every place that you've been. And so he said, oh, well, by the way, I went clubbing. You know, I went to 5 different nightclubs with my friends May 2nd while I had symptoms.
So, in Itaewon.
In Itaewon.
Which is again, just so everyone understands, it is like nightclub after nightclub after nightclub,
right.
Like lots of young people packed together. Okay,
right,
so
right.
I'm sorry.
So from midnight to 4:30 in the morning, he and his friends had gone to 4 different clubs, dancing, partying, drinking. And once the Korean CDC got this information, we knew, okay, the scale of who could have been exposed to this person's disease, infectious disease, was going to be big. And so we sent out public alerts on everyone's cell phones, on the radio, on TV. We said, okay, from April 24th to May 6th, anybody who has been to, you know, one of the identified clubs in Itaewon, whether or not you have symptoms, you need to get tested.
So, doctor, I want to say to you, this was you identified the person, but you didn't say, you know, his name. It was just a person that was infected. This is all kept anonymous, correct?
Yes, anonymous. But once we knew where he had been, then it was a massive public awareness campaign.
Right.
And we said, go and get tested. It will be anonymous, because, you know, people don't want to feel like they had done something wrong, you know, by going out and having fun with their friends, right? We wanted to eliminate any stigma, and it's free, and it's quick. Right. And we have, in Korea right now, we have more than 600 testing stations around the country. And
so when President Trump says we can't do that, you did it, or South Korea did it. They put testing in parking. Where do they put them? Where are testing facilities?
Right. So we have a very good public health system in place, community health centers throughout the country. So some of the screening centers are located there. Some of the screening centers are located in parking lots outside of hospitals and clinics. So they are very accessible. And of course, we have our now famous drive-through testing centers in Daegu, where we had our biggest outbreak. So anyone who had been to Itaewon, that club scene, during that time period where they could have been exposed to COVID-19, they were told to get tested, and it was anonymous. So
the testing is free, anonymous, and available almost everywhere.
Right. And so over the course of, I would say 12 days, we tested around 60,000 people related to this one outbreak. And we've been able to find about 200 positive cases related to this outbreak. And the reason why this is so important is because this is a very, the infectivity, it's so contagious. It spreads so quickly.
So, doctor, I know I'm all over the place, but so that's the thing. You know, we're in the States, and, you know, it's driving me crazy because I still talk to people who say this is not a big deal. So number one, can you just address that first of all? Is this a true danger? We shouldn't even have to talk about it, but I want to talk about it so people listening can know that. Is it a true danger? How dangerous is this?
Okay, so I just looked on the website. More than 96,000 people, Americans, have died due to COVID-19. So for reference, that's 2,000 more Americans that have died during the Vietnam conflict and the Korean War combined.
In a few months.
That's 96,000 deaths over 5 months. There were 94,000 deaths in those 2 wars over a combined period of 12 years. So, but it's not just the loss of life, right? It's the livelihoods that have been completely destroyed. America has been brought to its knees due to this very small virus. And the tragedy, not just in America, but in many countries around the world that have not acted as quickly and in as coordinated a fashion, the tragedy is that you can see, oh, it could have been prevented. It was
Right.
prevented.
And it was prevented. I mean, I think our leadership in Erie County has done a good job overall, but like South Korea has almost 50 million people. 50 million people.
Right.
Erie County has not even 900,000 people.
Uh-huh.
And I read this morning or saw this morning that Erie County has doubled the deaths. Erie County alone has doubled the deaths of all of South Korea almost. South Korea, we have like almost 500 deaths. South Korea has 200 something deaths. So it's because the United States as a whole did not react. It's because we weren't prepared. Because there was not early action. It was because we didn't get the testing ready. That would be your guess. I mean, obviously that's the difference. It's timing.
It's timing. So, but I mean, because there's a pattern. There's a pattern to what COVID-19 does. It infiltrates a community silently in the beginning. Okay. And unless you're doing massive testing, you can't separate the sick and infectious people from the healthy, right? If you can't identify the sick from the non-sick, you can't separate them. And if you don't separate them, then the virus hops from person to person to person to person very quickly. During this one last Itaewon outbreak, we've already seen what we call the 5th degree of transmission. So person A spreads it to person B. So person who went to the club spread it to his friend, who spread it to his coworker, who happened to go to a karaoke room and spread it to the mic that he was singing into, who spread it to the next person who sang into that same mic. I mean, it spread so quickly over 10 days, 5th degree of transmission. And you have to be able to break the chains of transmission if you want to get control.
And the only way we could do that is through frequent testing that is free, anonymous, and quick.
Exactly.
But also, we hear about contact tracing, right? So you talked a little bit about analog contact tracing.
Mm-hmm.
But in Korea, there's other ways they've done contact tracing, right? And contact tracing means who you possibly have spread the disease to, and can we get a hold of them so we can treat them and test them, so we can quarantine them so they don't continue to spread it. So how have they done that in South Korea?
Right. So the analog method is you know someone goes and they take an interview and the person tries to remember, oh, where was I yesterday? Where was I 10 days ago? Where was I 14 days ago? It's not very efficient. But in Korea, we have a very extensive IT network in place. So, and almost everyone has a cell phone. So what our law allows is if the director of the Korean CDC or the Minister of Health and Welfare deem that it is necessary to access people's personal data for the control of an infectious disease, they are allowed to access a person's credit card transaction information. So, for example, the person who went to the club, paid for a drink with his credit card and then went to the next club and paid for a drink with his credit card. So then we know exactly where this person has been by accessing his purchase data, from his credit card. Also, anytime you call someone on your cell phone, that in order to make the call, the mobile phone satellites or the networks have to be able to access where you are and then send the signals to where you want to call, right? So Korea has been able to, the government has been able to access that data, that information. And that tells us over the last 2 weeks, gives us information on top of what the person is able to remember, where this person has been. And if we know where the person has been, then we know who could have been exposed.
So doctor, I want to talk about that. They don't use that information to prosecute or anything else. It's kept anonymous, so they can. But here's what we're hearing in the United States. I've heard this multiple times on cable news. South Korea is not like America. It's not a freedom-loving country. It's not really a democracy. um, listen, in many ways, I've been shocked by the amount of democracy in Korea. Like, Korea threw out their president through mass protests a couple of years ago. I mean, I think if people in America saw the level of democratic participation, it can be overwhelming, right? So people there believe in their human rights and human dignity and civil rights and civil liberties the same way we do. Has there been massive pushback against, even if it's anonymous, the access to their phones and to their private information? Or has it been considered a necessity because we're in emergencies?
So the short answer is yes. You need to balance, right? You need to balance privacy and personal rights with the public good and the need to save lives. I have likened the fight against COVID-19 to a war. And I used, the statistics of how many people have died. It is as if we are at war. When you're at war, there are certain,
right.
other, laws and regulations that need to be put in place to protect, why? It's to protect the country, to protect
the public good,
yeah. Right, the public good. And so we understand that there is there's a delicate balance, but when the threat is so big, there may be some sacrifices that individuals need to make. Now, I will bring up this point. Korea was, way back in the beginning, we had the most cases after China, in the beginning.
When it first broke in January.
When it first broke. And so our approach, we were very sensitive to the approach that China took. China really cracked down, very hard. They completely sealed off Wuhan. They cut off the completely from transportation.
With military.
Right. Yes, and entire cities were walled off. Literally, walls were put in place so that there was no intercity transport, okay? And so Korea was very sensitive to the approach that China took. And we said, almost deliberately, we're going to take an opposite approach. We are not going to shut down the city of Daegu, where we had our biggest outbreak. We are going to make sure everyone is informed. And all of our measures are going to be polite requests to the people.
Right. Right. We're not. So you're basically the anti-China model. You wanted to do it with citizen participation and community rather than enforcement and authoritarianism.
Exactly. And so we were very sensitive to that. And that was our deliberate approach. Now, it was kind of, interesting how later on, many more so-called democratic countries had to take the China approach to get their disease under control.
Right.
They had to completely go into lockdown to get some degree of control and break those chains of transmission. Very interesting. But Korea never went into lockdown. Our economy has always been open. And even today, you wouldn't be able to tell that there's COVID-19 in Korea.
So right now in the city nearby where I live, the city of Buffalo, and by the way, you have a daughter that studies in upstate New York. I won't say where, but you have some connections to this part of the world too.
Exactly.
So you know this place, and what it looks like and how we live. There's a city nearby here. A handful of strange people had a protest today about how they want to go to the store and they want to go to restaurants. In Korea, people go to restaurants and go to the store, and they really never had the same level of lockdown that we had, correct? Because they're testing and because they're wearing masks. And like I know, I have friends and family there, obviously, and people they go to restaurants, they go all over the place. Am I wrong about this?
So there are three pillars of readiness. So if a society wants to be open in the age of COVID-19, your healthcare system needs to be ready. So you need to have hospital capacity. You need to be able to take care of your sick COVID-19 patients, in addition to all the other sick patients who need to
And
come
because Korea has a super robust public healthcare system where people, no one goes bankrupt in Korea for healthcare. So you have that. You have a very robust community-based healthcare system. And go ahead. That's the next point.
And also we have our trigger on, when is it that we have too many cases where then it's dangerous and we need to go into a more severe kind of social distancing,
Right.
So we know we've calculated, we've done the math. We know if we have more than 50 new patients a day, then we need to lock down a little bit. Okay.
Right.
We've done the math. And then the second is the public health system. And that refers to the testing, the tracking, and tracing. And this system that we have in place is phenomenal. And then the last is public participation. That's the last and maybe the most important pillar. In other words, people need to be on board. They need to know and actually do the hand washing. You should be washing your hands at least 5 times a day, if not more. They need to be wearing masks. They need to keep physical distance.
You need to sneeze into your arm, not into your hand, like I did.
Right. And then, and then it's not just private citizens, but institutions and organizations and businesses. They also need to know that they need to be ventilating their indoor spaces. They need to now take out a lot of chairs and tables in their restaurants because the maximum occupancy limits are different now, right? Because we need to make sure people are sitting at least 2 meters apart. A lot of places have put in like clear plastic shields so that people are not spreading infection. So it's multi-layered in terms of what needs to happen, what needs to be in place to safely open society and allow people to have some sort of normalcy and yet be safe with COVID-19 still circulating in the community.
So you've given me a ton of your time. I have just a couple more questions. The first question is, what do you say to people? Like, there'll be a counter voice that will say, listening to you, well, Korea lied about its numbers. The reality is Korea knows its numbers better than we do because you do the testing. So like you know what I mean? Like they'll say, there's no way they only have 250 deaths. And here, like I've heard this, like I've heard people say, oh, we have 95,000. They must have 2 million. They're lying about their numbers. There's no way, right? Because it's all tested and it's all transparent. Go ahead.
Exactly.
I know it sounds ridiculous, but I have to ask it.
Right. So, here's the thing. We know, like the public health experts, we know sort of the range of what COVID-19 can look like. We know the worst case scenario, the UK, Northern Italy, New York City. And then we know sort of the best case scenarios, New Zealand, Taiwan, South Korea. So we know the range of COVID-19. And, the numbers of South Korea, they're within the range. And so it's,
right. And plus you've tested how many people? You've tested literally how many people have you tested?
So we are now close to 1 million. So in terms of the number of tests, and we know the yield. In other words, we know that if we test 100 people, somewhere between 1 and 2 people will be positive.
Got it.
And of course, this depends on, are we targeting high risk, people, or are we targeting, people who may be at medium to low risk? For example, in Korea, because the conflict between North Korea and South Korea is still ongoing, every Korean male is compulsory. They are conscripted.
Military service, right?
Military service. So starting from Wednesday or Tuesday, we started to test every incoming soldier for the military service. So that's 6,500 young Korean men who are going to be starting their military service. We are now screening them for COVID-19. Every single one of them. Because we want to know, if you have COVID-19, don't go into the army barracks and then
to barracks and spread it. Right.
And so that's the degree of testing that we have going on. We both do targeting and we do sort of community or, high risk
based on high risk communities. Let me ask you this now. And you're an American citizen. You love this country, and your family's here. Your daughter's here, studying right now. What would you do if you had if you were in charge of our response? We're already late. We have bursts of it here and there. It looks good and it's not good. There's people fighting. How would you approach this if you were the president of the United States? And let's just pretend you had that authority. What would you do today?
So I would have once daily 1 hour press briefings where Dr. Anthony Fauci was leading.
Yep.
And he would, and this is based on what the Korean CDC
No,
does.
I laugh because it seems like it would be such a relief just to have him having press conferences instead of the press conferences.
So I mean, it having him on, nighttime, comedy, talk shows, that's fine. But every day, from say 11 a.m. to noon, he goes over the data, over the last 24 hours. And then, I'm sure he's already doing it, but he's coordinating, what is going on over the entire country. And
so a comprehensive approach rather than a state by state ad hoc approach.
Well, so there needs to be a central control tower, right? It's the United States of America and not the divided States of America. I mean, division in some degrees, that if you're an island, it's much easier to control COVID-19. But when you're united, there's travel, interstate travel. Once you open up the economies, an infected person from, New York can go and visit,
Maryland or Virginia,
family in Pennsylvania, and then get all 5 people sick, and then those people go to work and get, their coworkers sick, and that's how COVID-19 spreads. And so you need a central control tower who is scanning the entire country. What are the hot spots? Where are the pockets of communities that need more resources? Where are the communities that need more help in terms of PPE, personal protective equipment, that need more ventilators, that need more testing? You need someone who is assessing what's going on broadly and then coordinating the effort. Coordination is what's lacking. I think that's what's needed. And I would also say transparency and informing the public. But this information needs to be trustworthy, accessible, and timely. And that's what a 1 hour press conference with, someone who knows the
without
medicine.
The politicians, with the medical professionals that are giving people the facts rather than the spin.
Exactly, the facts, but also, who is well aware of what the government needs to do, what the public needs to do. So it's not just, a scientist who's looking under the microscope, but who, scientist who knows the microscope, but also knows the big picture.
A public health care expert who can help.
Exactly. Right. And we need that centralized, authoritarian, authoritative voice. And so I would say that's the first thing that I would make happen. And then that would help with how it's managed overall.
Well, I'm going to say to you, Doctor, you are a force of nature. You are just awesome. And I'm grateful for you to spare this time with us. I know it's early in the morning there. I'm thankful that you did this for us. And, I hope to see you again soon. When this thing dies down, I'll go visit, and great to see you again. I'm grateful for your time.
So you live in a beautiful part of the country. I would love to visit, and my heart goes out really to everyone who is struggling because of this. And I I hope that if you look, in other places, that people will get a sense that, okay, we can control this. We can emerge from this. It's not impossible. You can't give up. You can't give in. And if you do the right thing by listening to, the people who are the experts, the public health officials, the medical doctors, if you do the right thing, you can get over COVID-19, and you will. I know you will. So please, I hope that people feel encouraged by our discussion, and that people stay safe. And it's an infectious disease. If you just, wash your hands, cover your cough, do the right measures, stay at home as much as possible. Don't go clubbing.
No. I'm
Not
well past
anytime
my
soon.
days of doing that. But
Yeah.
listen. You're safe and good. Your family's good. Everyone's okay.
I am. Thank you so much for asking. Yes, we are.
And what's the weather like there today?
It's beautiful. It's a nice, warm, early summer day. And yeah, so my daughter's going to be graduating from a school in Troy, New York. And
Yeah.
so, yeah, I've been watching what's been happening in New York very closely, because of all of our connections there.
Right.
And
Right.
so I'm cheering. I'm cheering for your district. I'm cheering for the state of New York, for America.
Thank you so much, and thanks for just being a friend. I appreciate it.
Anytime. Information is one of the biggest tools against COVID-19. It's the only vaccine we have right now, right? We don't have a vaccine yet, but information is what we can use to prevent and control COVID-19, and it works.
Did you guys hear that? Information is the best vaccine we have. I love it. That's a great way to end. Well, doctor, I will see you soon, and be well and be safe. And thank you so much for helping us and sharing your experience. I'm so grateful.
You're very welcome. Thank you, Nate.
Bye-bye.